Hey there, I'm Dr. Ben Schmidt. I'm a GI fellow at St. Louis University. Do you have varicose veins? It's estimated that close to a quarter of US adults suffer from these enlarged veins that develop as a result of venous hypertension, incompetent venous valves, and stress on the body over time. Classically, varicose veins are well known for the associated cosmetic concerns, with many people not liking the appearance of these enlarged, tortuous purple veins. But varicose veins can also cause pain, irritation, and even worsen swelling of the legs. There are multiple methods for treating varicose veins, and you probably feel like you hear about a new one on the radio each week. But what is a good example of a safe, simple, and effective varicose vein treatment? Let's go talk to an expert. Dr. Keith Pereira is an interventional radiologist with SLUCare who can offer treatments for varicose veins. Interventional radiologists are doctors who are trained both in traditional radiology and at performing a wide variety of minimally invasive procedures. Thanks, Dr. Pereira, for joining us today. We appreciate you taking the time to talk with us.
Oh, thank you.
Can you tell us a little bit about the varicose vein procedure that you offer?
Yeah, so we offer this minimally invasive procedure that is very safe and effective. It has replaced previous surgical therapies. We go through a tiny pinhole in the calf, put a tiny catheter that goes all the way up into the groin area. And then once we get there, we use either laser energy or radiofrequency energy to actually close down that vein. And that helps improve symptoms.
And how does this procedure compare to the older procedures that were more traditionally done?
So the older procedures were surgical procedures. A surgeon would go in, make 2 incisions, and actually take the vein out. This is much better for the patient.
What types of patients would be better candidates for these procedures?
People who have varicose veins, and varicose veins are either when you see them as varicose veins, the discolored veins in their legs. More importantly, they cause symptoms. They cause heaviness in the leg, difficulty walking. So those are the symptoms that patients present with. If these are left untreated, they can lead to more changes like darkening of the skin or maybe even ulcerations of the skin. And that's what we see sometimes when they're in the late stages.
What types of patients in terms of demographics are you usually doing these procedures on?
Just everyone. Varicose veins do tend to run in families. There is a hereditary condition associated with it. It is more common in women than men. After pregnancy, again, it's pretty commonly seen. So these are the conditions where we see them, and that's when they come to us and we treat them.
Can you maybe describe the procedure kind of from the patient perspective? Like what can they expect when they show up for their procedure?
I'm happy you said procedure because that's what we call it. You don't call it surgery anymore because you come to the hospital, you don't even need to be fasting. You don't need to be NPO as you call it. We put you on the table, we just clean the area, give you local anesthesia, not even sedation, just local anesthesia, put that thin, tiny wire up and we perform this treatment. The treatment actually lasts 15 minutes. You get out from the table, we give you compression stockings to go home with, and then you're home. You're walking out of the hospital within an hour.
Oh, wow. So there's no real recovery time.
No, there's no recovery at all.
Right away, they don't have to miss work.
I've had some young women go back to work the same day. Yeah.
That's awesome.
Yeah.
What kind of feedback have you gotten from your patients in terms of like how well it works, how their recovery process was?
In terms of recovery, it is an easy recovery. There's no pain. You don't have to stay at home on the bed for a while. They wear compression stockings, which is very important. It causes a little pain in the legs after the procedure because you're wearing this compression and keeping that vein closed. So that's the only discomfort, really.
So no real big side effects to the procedure, any big complication risks that you would want patients to know about?
No, as with any procedure, there's chance of bleeding and infection can happen. We maintain sterility and stuff like that, so it doesn't happen. One of the smaller complications, but considered to be major, is if there is clot which goes into deeper veins and causes DVT, which is deep venous thrombosis. The incidence is less than 2 to 3%, but it can happen.
And where do you perform these procedures? Is it just at main SLU hospital or do you perform them elsewhere as well?
We perform at SLU hospital. We also perform at St. Mary's Hospital. Depends on where the patients show up in clinic. Yeah, we see them in clinic usually, either at SLU or St. Mary's Clinic, and then we perform this in the hospital.
Very good. Well, thank you very much for your time. I appreciate
You're welcome. Thank you.